Good evening. Thank you for watching. I'm Leah Hogg. This is our current affairs update in English. The Oxford vaccine for the coronavirus is showing a very strong immune response. And to speak to us about it is Professor Calum Semple, who is an advisor to the UK government on the coronavirus. He has also recently been awarded the OBE for his work on the novel coronavirus. Thank you very much, Professor Semple, for joining us. And congratulations on your OBE. It's very recent, really.
Good evening, Leah. It's a pleasure to be speaking to Malta again, and thank you for your kind words.
Thank you very much. I'd like to speak about the Oxford vaccine. It's reported to be showing a very strong immune response. What are your views about it?
The most recent good news is that it is showing a strong immune response in the elderly population. And these are the people most at risk of severe disease, the complications of this disease, and death. So the news that came out recently is really good news for many, many people. We already have evidence that it's providing a strong immune response in younger people, and the news that came out this week is that it's good for the older people as well. So this is the best possible news.
That's amazing. I mean, it's quoted in the papers, in the UK press, that 2 weeks after the second dose, more than 99% of participants had neutralizing antibody responses. That's going to really build our hopes, I believe.
That's right. And the reason they use this unusual term, which says neutralizing antibodies, is because you can have any antibody to any part of the virus showing that you've been perhaps exposed, but it's the neutralizing antibodies that are protective. So the importance, the scientific importance, is that we've generated a protective response in the older population. And they're the ones traditionally who it's difficult to develop a vaccine for. Now, I should say this is not my work. I'm a commentator. But I do support the work that is done in Oxford, and it is just a very happy time for us.
At this stage, I mean, can we really raise our hopes that the vulnerable are going to be protected?
Yes, that's something that we should be confident about, that if you are generating a strong neutralizing antibody response, this will protect the vulnerable elderly people. Now, there are always some people who will not respond to the vaccine. And the data today, the data from yesterday's publication, is that perhaps 1 in 100 people will not be protected. So this means that we will still have to be careful with hand washing. We will still have to take precautions. But in the vast majority of cases, we will be able to protect our vulnerable but very loved elderly relatives from this horrible disease. And that will also enable visiting in due course and a certain resumption of normal activities for these people in our community, so they'll be able to integrate better within society. It's good news all round.
What are your thoughts about the mass production of inoculations and treatments?
This is where the challenge will now lie. It will take time to produce enough vaccine stock to immunize large populations. Advanced orders are already been made by many countries, but it will take time to mobilize vaccination teams. It will take time to move through the community. And I think we need to spare a thought for countries that are not in such a strong financial position as ours, countries such as parts of Asia and parts of Africa, parts of South America, where they may not have the financial resources in order to acquire sufficient vaccine stocks for their communities. And that will remain a challenge for society going forward.
I'd like to refer to the documentary, the BBC documentary, which I believe is also airing tonight, and it's called Lockdown Following the Science. I'd like to quote you. You said there's a lot of criticism, as it's easy to have hindsight. Can you expand on this? Because to me, it seems to make a lot of sense.
The scientists and politicians being criticized, sometimes for acting too slowly or not making the right decisions. And speaking as a scientist, much of this is unfair because there was very limited information available in January and February about how this virus behaved. Even now, in the United Kingdom, it's very difficult to predict the effect of community-wide interventions such as lockdown because of the lag in time between an intervention being made and the effect on hospital admissions and deaths, because the nature of the virus is such that it takes 5 days for most people to become unwell, another couple of days to become so sick that you might need to go to hospital. And then in hospital, with the best efforts and care, it might be a week or so before, sadly, you might recover, might pass away or need intensive care, or better still, recover. At that timeline up, you're talking about a sort of 2 to 3 week period. So if you make an intervention today, such as starting a lockdown, you cannot tell if it's worked for 2 to 3 weeks. And this uncertainty is often difficult for communities to understand and sometimes difficult for politicians to understand. Consequently, we're often criticized because we have to make decisions before we have all the facts.
Absolutely, but I mean, what I'm seeing and everyone's seeing, I think every country is similar with the criticism that both the medical profession receive and leadership receive. What would your message be, a positive message to try and look forward and try and look at something positive?
There's great reasons to be optimistic. We have now had early positive results for at least 3 vaccines. The Moderna vaccine, the Pfizer-BioNTech vaccine, and the Oxford vaccine group. So there's at least 3 vaccines which have got evidence of high immunogenicity. We also know that social distancing, hand washing, using a face mask do affect the virus in the community and bring it under control. We also know that the drug dexamethasone is highly effective in hospital. And our doctors and nurses have learned to look after people better, such that the overall hospital case fatality rate has fallen from about 1 in 3 down to 1 in 6. So in a period of 11 months, we have taken a virus that was killing 1 in 3. Now it kills 1 in 6. And we've got 3 vaccines that will be ready for the new year. And there's a lot to be optimistic here. I think this has been a horrible year for many of us, tragedies for many families. But I think next year will be much better. And that's only because of hard work from good scientists and good doctors. And I think criticizing the scientific and clinical community is very easy to do with hindsight. But my experience has been that the vast majority of my colleagues got up and worked hard, and as a result, society is in a better place.
Thank you. May I take a few moments, child health specialist. What is the status right now? Has there been any changes about children and the spread of the virus?
There's been a couple of developments. At the start of the outbreak, we were very encouraged to observe that children were not suffering severe disease. we now know that a very small number of children experience an inflammatory condition, which is called multi-inflammatory. We call it multi-inflammatory syndrome associated with COVID, MISC, and this can be severe, but thankfully it is incredibly rare. So children we now know make up 1% of hospital admissions, and of that, less than 1% will die. So severe disease and death from COVID is very rare in children, but we now know to look out for the inflammatory condition, which can affect a small number of them, perhaps 11% of that 1%. So that's a new bit of knowledge that we have to watch out for, and we have to take great care of these children.
And does this...
I was going to say, we also know that older children, in our society we call them secondary school children, these are the children between 12 and 18, we know that they now can transmit the virus even though they don't get severe disease themselves. So we know that teenagers have a role in transmitting and amplifying the virus and bringing it back into homes. So we understand how the disease affects them and also how they spread the disease.
With regards to the spread of the disease, the transmission from children, do you believe that parents are also vulnerable? We all know that grandparents are.
Well, some parents will have underlying health problems, and then they will be vulnerable. So children should be taken care of when they come home from school. They should be washing their hands as they enter the house. And if their parents are extremely vulnerable, then the family needs to be on the lookout for any symptoms within the family. And if one of the children gets sick, then they have to think very carefully, how will they organize their household as best they can to limit exposure to the adult that is vulnerable. But it is a real world situation. It is very difficult to manage these issues within a family, and inevitably some children will pass the virus to their parents.
May we refer to lockdown in the UK? We're not on lockdown in Malta. What are your thoughts about lockdown? Do you find it quite drastic, or do you agree with it?
I do agree with it. In my city of Liverpool, we had some of the highest cases in the community last month. And we entered Tier 3, what we called Tier 3, which was a community intervention. We were in Tier 3 for 17 days before the rest of the country went into lockdown. We are now seeing the benefit of that in Liverpool because hospital admissions are now falling in the northwest of England and in Liverpool. So the rest of the country is still seeing hospital admissions rising, whereas Liverpool, where we had the Tier 3 and then the lockdown, hospital admissions are falling. So this gives us also hope because it shows that Tier 3 works. And remember, lockdown is a higher level of intervention, so we can be confident that the lockdown will work and bring cases down. My worry is that when lockdown ceases on the 2nd of December, that perhaps people go a little bit, easy on the regulations. They go around for parties, they start the Christmas shopping, they don't pay attention. And there's opportunities between the 2nd of December and Christmas Day for a lot of misbehavior, and that will drive cases back up again. So we have to treat this disease with respect.
Yes, I thank you very much for your time today, Professor Semple. Thank you very much, and I wish you a lovely evening.
Thank you for this opportunity to speak to the people of Malta. Thank
you. That was Professor Calum Semple, who is a child health specialist and an outbreak health specialist, and he spoke to us about vaccines and the state of play on COVID-19. We're going to have a very short break, and I'll be with you in a few minutes.